Today we're talking about 5 sleep disorders that you will see in your clinical practice, and I'm going to share some celebrities that have these sleep disorders. Before we jump in, I'd like to invite you to subscribe to this channel and also to click like on this video if this type of information is helpful for you. Doing so helps get the word out for a small channel like mine, which is focused on helping clinicians like you, physicians, therapists, healthcare practitioners, get a better handle on sleep medicine, because most of us only get about 2 hours of clinical sleep medicine training during medical school, but all of our patients have to sleep. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. This channel is for you as a clinician to learn about clinical sleep medicine tools in a really practical, fun, easy, and accessible way, and also to get CME credits. If you watch all the way to the end of this video, then you can go to the video description underneath and click the CME link to get your free CME credit. A quick disclaimer, the information that I'm sharing here is information only and is not medical advice. Let's start with a pop quiz. How many sleep disorders are described in the ICSD-3? The ICSD is the International Classification of Sleep Disorders. Let me know in the comments how many sleep disorders you think there are in the ICSD-3. Watch all the way to the end to find out the answer. These are the 5 sleep disorders that you will see in your clinical practice. If you haven't already seen these, then be on the lookout for them, because your patients do have these disorders. I'm talking about insomnia, obstructive sleep apnea, restless leg syndrome, circadian rhythm disorders, and narcolepsy. We're going to go through these one by one, and I'll share some celebrities for each of these examples. Okay, but first of all, why do you need to know these sleep disorders? As you know, sleep disorders can look like other conditions. Insomnia isn't always insomnia. Your patients will come to you telling you that they're struggling with insomnia, but it actually could be something else like restless leg syndrome or obstructive sleep apnea or some other type of condition. So we need to have these in our mind as the differential diagnosis. The CDC and the WHO have declared sleep deprivation as a public health epidemic, but a review found that 60% of adults had never been asked about sleep by their physicians. It's estimated that 50 to 70 million American adults suffer from some kind of a sleep disorder, which affects their daytime energy levels, wakefulness, their day-to-day functioning, and then of course their overall health and longevity. Sleep is something that we should be thinking about for all of our patients, even if you're not a sleep doctor, and that we should be asking about in clinic. Okay, let's start with insomnia. So you can break insomnia down broadly into 2 categories, acute and chronic. Acute insomnia is usually caused by some kind of stressor, and it usually lasts just a few days or weeks. Chronic insomnia, however, is what you'll usually see when patients come to you for help. This is defined as difficulty falling asleep or staying asleep at least 3 nights a week for 3 months or longer. The patient needs to have dissatisfaction with their sleep quality or quantity, plus 1 or more of the sleep difficulties listed here. These include difficulty falling asleep, staying asleep, waking up too early, or having unrefreshing sleep, or the sleep issues are causing significant distress or interfering with the person's day-to-day activities. The sleep difficulty occurs at least 3 times a week. It's present for at least 3 months. Or, and this one's important, the sleep difficulty occurs despite adequate opportunity and circumstances for sleep. Okay, do you recognize these 3 people? We've got Shaquille O'Neal on the left, Amy Poehler in the middle, and then Shonda Rhimes on the right. What do all 3 of them have in common? The answer is all 3 of them have obstructive sleep apnea. It's estimated that about 39 million adults in the United States have obstructive sleep apnea, and nearly 1 billion adults around the world have mild to severe OSA or obstructive sleep apnea. That's a lot of people. So we really need to be on the lookout for this in our practice. When sleep apnea is left untreated, it can lead to a whole host of different kinds of health issues like heart disease, renal issues, metabolic health issues. I'm a psychiatrist, so I'll see patients with treatment-resistant depression, excessive daytime fatigue that's been attributed to depression, anxiety disorders, nightmares, panic attacks, all kinds of symptoms. So we really need to have this on our radar. When sleep apnea is treated, it can significantly improve a person's quality of life and help regulate their blood pressure. And again, if you are seeing patients with depression, keep in mind that nearly 20% of people with depression have obstructive sleep apnea. Here are some clues as to obstructive sleep apnea. Oftentimes we think of the patient with a large neck, more than 17 inches, male, overweight, with loud snoring. That's the classic archetype for sleep apnea, but it can show up in other populations as well. It can be more subtle in women, it can happen in children, it can happen in thin people and petite people, all kinds of people. Some clues that you want to look out for are difficulty falling asleep or staying asleep, so it can look like insomnia. Bruxism, including grinding of the teeth and then clenching of the jaw, also can be a symptom. Uncontrolled hypertension, treatment-resistant depression, those are also clues. Other symptoms like a dry mouth in the morning, sore throat or a headache in the morning. Excessive daytime sleepiness in adults can be a symptom, and in kids it can show up more like hyperactivity. It can look like ADHD. And then be on the lookout in your postmenopausal women. You'll find that around menopause and after menopause, women struggle a lot with sleep, especially sleep maintenance. And I often see this in physician Facebook groups that people are jumping to solutions without thinking about testing for sleep apnea first, which becomes much more common in women after menopause. 47 to 67% of postmenopausal women have been found to have obstructive sleep apnea. All right, moving along. What sleep disorder does Jon Stewart have? Jon Stewart has restless leg syndrome, which he has famously referred to as his Jimmy legs. This affects about 5 to 15% of the population. Restless leg syndrome happens in all genders, but it's more common in women. It's 3 times more common in pregnant women. I actually just saw a pregnant patient this morning who has new onset restless leg syndrome, which is related to her pregnancy. And there's a higher prevalence in pregnancy during the 3rd trimester. Some clues as to restless leg syndrome. It can look like insomnia, where patients have difficulty falling asleep. They just can't get comfortable. There's usually an urge to move, and there's typically a diurnal pattern to it. They'll often say it comes on like clockwork at a specific time in the evening. It's usually worse when they're sitting or they're lying down. It can feel like creepy crawlies. It can feel like itching, pulling, and aching sensation. It can feel just like they're jumping out of their skin. It may be related to iron deficiency. It can also be related to use of SSRIs. So if you're seeing patients on selective serotonin reuptake inhibitors, these can cause symptoms of RLS. It's more common in patients with a family history, and then it is disruptive to a patient's sleep, so they might complain of daytime fatigue and sleepiness. Restless leg syndrome is one of these things that's been made fun of, or people don't think it's a real disorder, but it truly is, and in some cases, it can really be debilitating for people. So we do want to be taking this one seriously and screening for it in our patients. All right, I'd like to invite you to my free upcoming masterclass on sleep supplements. I get a lot of questions from my patients and other physicians about supplements like melatonin, magnesium, and other things for sleep. So I put together this free masterclass. It's for clinicians. We're going to be talking about 5 different sleep supplements that are important for you to know because your patients are likely taking these. As healthcare practitioners, we need to understand them and how to use them. So you can sign up. The link is there on the screen. I'll put the link in the video description below and in the comments if you want to sign up. It's taking place February 13th, 14th, and 21st. It's live. I'll be there live. You can come ask questions and you can reserve your seat now, and I would love to see you there. Okay, so moving along. I don't have a celebrity for this one, but you can see this picture of the kid in the middle there who's got his head down. What sleep disorder do you think he has? Okay, I know it's not really a fair question because I didn't give you any history. It really could be anything. It could be obstructive sleep apnea like we just talked about in kids. However, what I was thinking about with this one was circadian rhythm disorders, particularly delayed sleep phase syndrome. You'll see this more commonly in your teens and young adults. Oftentimes with delayed sleep phase syndrome, the DSPS that you see there, patients have trouble falling asleep and then they can't wake up on time in the morning. So they might not fall asleep till 2, 3, 4 o'clock in the morning, and then they can't get up before noon, or it's painful for them to get up in the morning for school or for work. Yes, is the opposite. It's advanced sleep phase syndrome. This is where people fall asleep too early in the evening and they wake up too early. You'll see this more commonly in your older adults, your patients who are maybe falling asleep around 8 p.m. and then they're waking up at 3 or 4 o'clock in the morning. This can get misdiagnosed as depression associated with early morning awakenings, whereas delayed sleep phase can get misdiagnosed as sleep onset insomnia. So a clue here is if your patient has quite different sleep schedules on weekdays versus weekends. Okay, so what sleep disorder does Jimmy Kimmel have? He has been vocal about his diagnosis of narcolepsy. So narcolepsy doesn't always show up like it does in the movies of people falling asleep at random times and having sleep attacks. Some patients do have those kinds of sleep attacks, but it's not always that dramatic. Often patients will say that they never feel rested, they're tired all the time, they have chronic fatigue, they have excessive daytime sleepiness. This can look like insomnia because they do have disrupted sleep. You get this intrusion of REM sleep into wakefulness and vice versa, and so they never get a fully consolidated night of sleep. They might wake up throughout the night, and it can look like insomnia. Narcolepsy can occur with or without cataplexy. It can also be associated with sleep paralysis or hallucinations when falling asleep or when waking up. And some people might complain of difficulty paying attention. They might be falling asleep in class. They might be falling asleep at the wheel. It can be quite dangerous. To clarify, cataplexy is when people have loss of muscle tone, usually precipitated by a strong emotion like laughing or anger. So they might find that their jaw goes slack or their knees go weak or or they find it hard to hold a cup or hold a pencil or something like this. Narcolepsy is one of these diagnoses that is missed very frequently. A 2016 study found that in patients who had a confirmed diagnosis of narcolepsy, almost 50% had been misdiagnosed at some point. The average time between the onset of symptoms and an accurate diagnosis ranges anywhere from 8 years up to 22 years. These patients are really suffering. And again, it's one of these conditions that sometimes people don't take seriously. Oh, you're just tired all the time. But it really can have a significant impact on a person's daily life and functioning. It can have mental health consequences. So it's something we need to be on the lookout for. Okay, those were the 5 sleep disorders that you will encounter in your clinical practice. To recap: insomnia, obstructive sleep apnea, restless leg syndrome, circadian rhythm disorders, and narcolepsy. Back to our pop quiz from the beginning. How many sleep disorders are described in the ICSD-3? The answer is there are over 80 sleep disorders that are described. Did you get it right? Is that surprising to you? Let me know in the comments. And then I'd love to hear from you. Which of these sleep disorders that we talked about today have you seen in your clinical practice? Let me know in the comments. Before we jump in, I'd like to invite you to subscribe to this channel and also to click like on this video if this type of information is helpful for you. Doing so helps get the word out for a small channel like mine, which is focused on helping clinicians like you, physicians, therapists, healthcare practitioners, get a better handle on sleep medicine.